we're back, and a quick thanks to Winter Park Resort. Big winter for them. They're celebrating their 75th anniversary, 75 years of imagining more. But right now I've got Jenn Fanning with the Grand County Rural Health Network here to talk about a variety of things. But first, let's just talk about Grand County Rural Health. What does that mean?
Sure. Well, we're a nonprofit organization for Grand County. We were created basically to be a nonpartisan voice, an advocate for the people of Grand County, and that's pretty much where we've been trying to fill that role. We also do a bunch of stopgap services, programs that just kind of fill the gaps, fill the holes for the community.
And when we say rural, it's partially because our county is not big. Our towns are small, year-round population, and the actual residents up here is kind of spread out with a bunch of different small little towns kind of thing. And so,
yeah, correct. We're the epitome of a rural resort region. So. It's and we've got ranchers on the other end, and
ski bums and ranchers to everywhere in between, mine workers, and
Yep, everything. So it's a unique challenge to make sure that the people in our community have the healthcare access that they need, and just moving forward to hopefully improve the healthcare system on anything that we can do locally, make changes.
Absolutely. And what's your role with them specifically?
I am the executive director.
Executive director. Okay, so you are a big part of the Rural Health.
I run the show.
That's incredible. Yeah, no, it's a wonderful thing. And so how long have you been running the show, or even with them? You know, have you grown within, or did you come in as the director?
Yeah, absolutely. I started 7.5 years ago as the program coordinator, and I was program coordinator for about a year before I became executive director. So it's been about 6.5 years.
Awesome. Wow.
With the network.
And you came in 7 years ago. From where?
A variety of places. I was one of the uninsured seasonal workers for several years.
In town?
Up here in town, yeah.
Okay, so ski bum more or less.
More or less. I came up here for a winter and
to do what? What sucked you in? What job?
I was what's the actual title? The assistant manager or whatever at one of the retail stores at the resort.
So you're working for the resort. So you were a true ski bum.
I was a true ski bum, except I didn't get to ski as much because I had the responsibility level, and then I was too poor to leave at the end of the season. Stayed for the summer and decided this place is amazing.
So was that a year-round job?
No.
Okay,
no,
so it was still seasonal. Yep.
Yeah,
okay.
I found other jobs. I worked, I think, doing catering for the resort that season, and got a job for Century 21 doing marketing, and then eventually at Dino's I did piecemealed all those together.
So you checked a lot of the local boxes of a true local, you know, Dino's especially. Yeah, that's great. Yeah. And so you came from where?
From Colorado Springs. I'm an Air Force brat, so I've been all over the place. So my home state is New York State.
So was healthcare your education, or is this kind of by being in the town, seeing the needs, and kind of started out as finding a job and it turns into a career here?
Yeah, a little bit of both. I was in the Peace Corps for 2.5 years in West Africa, and there I did community health education and AIDS prevention, and discovered public health, basically. I was an Air Force brat, so the epitome of having access to healthcare. I always had access to healthcare.
Right.
I never knew that there was an issue for people in our country. I was just kind of blinded by that. So the Peace Corps really opened my eyes to that and created a passion for me, and I moved up here thinking I would eventually get back into it, and I did.
Oh, incredible. So you've covered some ground. And so Grand County is now home?
Grand County is home.
All right. Well, I think we're going to talk a little more about the healthcare and kind of some of the changes we've seen and things coming up here when we come back, but we're going to take a quick break and see what's going on outside.
Sounds great.